Hello, my name is Austin Harbo. Today I'll be going over my critical thinking assessment reflection. So, the purpose of this reflection is to compare both my entrance versus my exit ATI results, identify strengths and areas of growth that I have, and to connect critical thinking to practical nursing. So, after reviewing my ATI critical thinking entrance and exit assessment results, I was able to clearly see both my growth and areas that I still need development. Overall, my scores for the entrance was 72.5%, my exit score was 75%, showing an overall increase in my critical thinking skills throughout nursing school. So, a little bit of a categorized breakdown for each of these. So, for interpretation, I increased from a 33.3% to a 66.7%. For inference, I increased from a 66.7% to an 88.9%. Evaluation, I decreased from 100% to an 87.5%. Analysis, I stayed the same at 50%. Explanation, I decreased from 85.7% to a 71.4%. And self-regulation, I decreased from 100% to 75%. So, there were some surprises in my results. I did have strong gains in both interpretation and inference, which was really awesome to see. I do feel like I did very well on these, and it was good to see this come out in the assessment. Unexpected were decreases in both explanation and self-regulation, as I felt like I was working on these, but obviously in an exam type situation, I was not as high up as I wanted to be with those. So, critical thinking in nursing is specifically built into 5 different aspects, which we just saw on the critical thinking assessment, which are interpretation, analysis, evaluation, inference, and explanation. So, to start out, interpretation in nursing refers to understanding and making sense of patient data, such as vital signs, lab values, assessments, and patient statements. For example, recognizing that a trend of decreasing blood pressure and increasing heart rate may indicate internal bleeding requires strong interpretation skills. My improvement in this area likely came from repeated exposure to patient situations and scenarios in clinicals and simulations. More careful assessment interpretation was required before taking any action. Next up, we have analysis in nursing. Analysis involves organizing information, recognizing patterns, and prioritizing care. Nurses use analysis when deciding which patient needs immediate attention or which intervention should be performed first. Even though my analysis score did not improve, nursing school constantly challenged this skill through care plans, prioritization questions, and complex patient scenarios. This tells me that while I have a baseline skill level, I need continued real-world experience to strengthen this area. Next up, we have inference and evaluation in nursing. Inference is the ability to draw conclusions and anticipate potential complications. This is especially important when recognizing early signs of patient deterioration. My improvement in inference likely reflects increased clinical exposure, such as my time in the PICU at HCMC, particularly in those high acuity settings, where anticipating changes in patient's condition become much more important. Evaluation refers to determining whether interventions are effective and whether information is reliable and relevant. Nurses use evaluation for reassessing pain after medical administration or determining whether a plan of care needs adjustment. Although my evaluation score slightly decreased for this, it remained relatively strong, likely due to frequent reflection during clinical post-conferences and simulation debriefings. Lastly, we have explanation in nursing. Explanation involves clearly communicating clinical reasonings to providers, patients, and other nurses. This includes SBAR reports, handoffs, and patient education. While my explanation score decreased, nursing school required frequent verbal and written communication, which suggests that this skill continues to develop more strongly in practice than in testing situations. Overall, nursing school experiences such as simulations, clinical rotations, and NCLEX-style questions helped me immensely to improve my interpretation and inference skills while highlighting areas such as analysis and self-regulation as places I need to have continued focus on in the future. Now, some strategies for my growth. The 2 areas I need to focus on most moving forward are analysis and self-regulation, as weaknesses in these areas can directly impact patient outcomes. Difficulty with analysis may affect my ability to prioritize care effectively, which could delay critical interventions. Challenges with self-regulation can impact decision-making under stress and limit my ability to reflect on and adjust my clinical judgment. During my first year of nursing practice, my main goal is to improve prioritization and reflective thinking. To strengthen analysis in specific, I plan to ask experienced nurses and preceptors to explain their thought process and to explain what they're prioritizing care for and why they are doing it. I will review rationales for clinical decisions and practice breaking down complex patient situations into clear prioritizations during handoffs and shift reports. To improve self-regulation, I will intentionally reflect on challenging patient situations through informal debriefing with my coworkers. I will also seek some feedback on my clinical judgment and stress management, especially in high-pressure situations. I also plan to use evidence-based resources and slow down when making decisions to avoid cognitive overload. These strategies will help me build confidence and improve my critical thinking skills over time. Lastly, we have the final reflection. So, one of the key lessons that I did learn from this assessment process is that critical thinking overall develops gradually over time and requires continuous reflection and practice. Growth does not always occur evenly across all areas, as we can see through my assessment. And even strengths can fluctuate over time. Comparing my entrance and exit assessments helped me recognize how clinical experience directly improved my interpretation and my inference skills, which was expected when I was taking that last final assessment. Strengthening my critical thinking abilities will benefit my future nursing practice by both improving my confidence, my clinical judgment, and my ability to adapt to complex patient situations that I could be seeing in the future. By continuing to reflect, to seek feedback, and to use evidence-based practice, I can provide both safer, more effective, and more patient-centered care. This reflection has helped me better understand my growth and prepare for continued development as a professional nurse in the future. Thank you.